What if your sore throat felt like swallowing glass and no one warned you it was coming? I'm Dr. Chelsea McGee, and this is The Real 411. Today, we're talking about the new COVID subvariant that's making headlines for all the wrong reasons, Nimbus, or NB181. If you've seen the phrase razor blade throat floating around, you're not alone. This thing is spreading fast, and the symptoms are, well, let's just say they're not your average sniffles. I've seen it firsthand in my clinic. A patient came in thinking it was just allergies, but the pain was so intense, it nearly delayed the right diagnosis. We're going to break down what's really happening, the data, the spread, the science, and why public health messaging might be failing us again. Because as always, the story is never just a headline. So let's start at the beginning. Nimbus, officially NB181, was first spotted back in January of 2025. Fast forward to June, and it's everywhere. Let's talk about the common symptoms and presentation.
COVID variant is showing up in the U.S. and bringing with it a pretty severe side effect. Officially, it's called NB181 or the Nimbus variant, but people are starting to call it razor blade COVID because of the pain that it causes in their throats. It's so severe that they say it feels like swallowing razor blades. Right now, the state's health data tracker has Nimbus as the second most common variant in California, but also the fastest growing. And the CDC says it accounts for about 37% of all cases in the U.S. and should become the dominant strain by the end of the month. I spoke with Dr. Mohammed Azam from Sharp Community Medical Group, who told me the number of cases is still pretty small, but people who are high risk should be careful.
This particular variant, even though it's relatively mild, except for the razor throat, it's very infectious compared to the other strains. COVID has now become just like the common flu or other respiratory viruses. So it's part of life, and there will be peaks and so on. And just like flu, there'll be some times really nasty strains, and sometimes it's mild. So just had to be careful.
A razor blade throat sounds horrible. Dr. Azam says that the current vaccines are effective against this variant, and people should think about getting one this summer since we typically see COVID peak in August or September.
In California, it's gone from barely a blip to making up more than half of the circulating virus, according to the state's public health department. Nationally, the CDC says Nimbus is now about 37% of COVID cases, basically neck and neck with the previous top dog, L81. And it's not just the U.S. The UK is seeing a similar trend. Cases and hospital admissions are up nearly 10% in just a week. Now, you might hear the term variant under monitoring thrown around. What does that actually mean? Well, the World Health Organization uses it when a variant is spreading fast enough to raise eyebrows, but there's not enough evidence yet to call it a major threat. It's like, hey, keep an eye on this, but don't panic yet. But here's the thing. By the time we're told to monitor, it's often already everywhere. And honestly, I think that's part of why people are so confused. When do we sound the alarm? When is it just noise? It's a tough call, and I don't envy the folks making those decisions, but I do wish the messaging was clearer. Now, let's talk about what makes Nimbus stand out. The big headline is the razor blade throat. Patients describe it as swallowing shards of glass, and honestly, that's not an exaggeration. It's a severe stabbing pain at the back of the throat, sometimes so bad people can barely swallow water. But it's not just the throat. Fatigue, cough, fever, muscle aches, congestion, those are all still in the mix. Some folks even report digestive issues like nausea or diarrhea, which isn't always typical for COVID. Now, is Nimbus actually more severe? The data says no. Hospitalizations and deaths are still low. Experts from University of California, San Francisco, and Baylor say it's not more dangerous than previous strains, but it does seem to spread faster, probably because of changes in the spike protein that help it dodge some of our immune defenses. That's what we call immune evasion. It means even if you've had COVID or been vaccinated, you might still get infected, though you're less likely to get really sick. Let me give you a real-world example. Just last week, I had a patient, let's call her Maria, come in with a sore throat so bad she could barely talk. She thought it was strep, but her rapid test was negative. If I had not been paying attention to the new variant news, I might have missed it. We did a COVID test, and sure enough, it was Nimbus. The point is, these new symptoms can throw off even experienced clinicians, especially when the messaging is slow to catch up. So, what about vaccines? Here's where things get messy. The good news, current vaccines and boosters are still expected to work against Nimbus. The bad news, the guidance on who should get them keeps changing. Just last month, the CDC dropped its recommendation for healthy kids and pregnant women to get the COVID shot, which honestly has left a lot of us in the medical community scratching our heads. The American College of Obstetricians and Gynecologists and the American Academy of Pediatrics have both pushed back, saying the science still supports vaccinations for these groups. And I agree. Pregnant women in particular are at higher risk for complications, and the vaccine helps protect both mom and baby. But when the official guidance shifts, people get confused. I've seen it in my own practice. Patients asking, should I get the booster? Is it safe for my kids? What about my elderly parents? And when the message is mixed, the people who suffer most are the ones already at risk. Older adults, immunocompromised folks, low-income families who might not have access to care. We saw this with the last round of policy changes, and as we discussed in previous episodes, mixed messaging can erode trust and make it harder to get people the protection they need. If we want to keep people safe, we need clear, consistent communication, period. So, is this just another COVID scare story? I don't think so. Nimbus is real, it's spreading, and symptoms are no joke. But panic isn't the answer. Information is. I want to hear from you. Have you or someone you know had the razor blade throat with the Nimbus variant? Drop a comment below. And if you know someone who's confused by all the changing guidelines or vaccine updates, share this episode with them. Subscribe to The Real 411 for more bold truth where the headlines fall short. Because as always, the story is never just a headline. Stay safe, stay curious, and I'll see you next time.